My name is Feng. I actually went to school in Canada, and I was a family doctor for the first 30 years of my career, and I loved it. And addiction medicine wasn't anywhere on my radar. Like I tell people, I didn't go to medical school thinking, when I grow up, I want to be treating heroin addicts. That's just not what wasn't on my radar. But when the opioid epidemic hit, and I saw patients of mine that I knew to be good, hardworking, decent people who, I remember one particular person who got hurt and was put on all kinds of pain pills. And when he got cut off, he ended up, in order to feed his family, turned to the street, and next thing you knew, his life had come unwound. And we treated him, and within a few months, he got back to the way he was, healthy, family man, back productive again. And that's when I realized, I say, that is a disease. We have somebody who's healthy, got sick, he gave him medicine, they got better. If that's not a disease, what the heck is this, right? And once I realized that we are truly dealing with a disease, and it's not just some, a saying, okay, it is truly a disease, then all of a sudden, it changed how I looked at things. To begin with, I think this is a super important question, because if you don't understand why addiction is a disease, you have it in the wrong mental bucket. If you have the wrong mental bucket, it changes everything of how you think about it, right? And we're used to thinking that addiction is things like choice and whatnot. How I like to convince people that it's a disease is I like to compare alcoholism, which is your prototypical form of addiction, with type 2 adult onset diabetes, which is, everybody's going to agree, is a disease. Now, how are these two things different? How are they the same? First of all, both of these things run in families. Whether you think it's genetics or you think it's upbringing, it runs in families. If you have a family history full of alcohol, you're likely to be alcoholic. If you have a family history full of diabetes, you're more likely to be a diabetic. So it runs in families. The second commonality is that both of these things depend on how and where you grow up. If you grow up poor in a southern state like Alabama or Mississippi, your chances of becoming diabetic is 4 times higher than if you grow up middle class in a state like Colorado. It just is, okay? Similarly, if you grow up among the Mormons in Utah who never touch alcohol, your chance of becoming alcoholic is just about zip, okay? You move one state over to Las Vegas, Sin City, and pardon the pun, but all bets are off, right? Your chance of becoming an alcoholic goes up quite a lot. The third area of commonality is that both of these diseases are really diseases of lifestyle. Okay, if you're somebody who eats fast food, drinks pop, and refuses to exercise, your chance of becoming diabetic goes up. Similarly, if you're somebody who drinks alcohol at every social turn, every time you're together with friends, with family, with Christmas, weddings, celebrations, anything's always got to involve alcohol, then your chance of becoming alcoholic goes up. Both of these conditions involve multiple organ systems. Diabetes affects your kidneys, affects your blood vessels, it affects your nerves, among many other things. Alcohol affects your liver, affects your pancreas, affects your heart. Incidentally, if you look at the liver of an alcoholic and the liver of a diabetic under the microscope, they are indistinguishable. You can't tell them apart. Okay, but both of these things affect multiple organ systems. Finally, both of these conditions stem from an inability to control consumption. Diabetics cannot quite control how much sugar and calories they consume. Alcoholics cannot control how much alcohol they consume. That is actually the entire difference between these two conditions, okay? If your problem is with sugar, you become diabetic. If your problem is with alcohol, you become alcoholic. So, How can we say this is a disease, this is not a disease? Okay, so there's an old saying, if it looks like a duck, swims like a duck, flies like a duck, walks like a duck, it's a duck, okay? So at this point in time, if you want to tell me that addiction is not a disease, I shouldn't have to prove to you it's a disease. I want you to prove to me that it's not a disease, okay? This became my organizing principle because it actually helps me address addiction.